Okay, I'm going to go ahead and get started and answer any questions that folks have as I go along. Today's webinar is about SUD, substance use disorder, and mental health consent training. Um, and I'm going to go over our consent tool and specifically our consent tool as it relates to sharing information about substance use disorder and mental health, also known as 42 CFR Part 2 data. And I'll get into that in a little bit. Next slide. So today I'm going to do an introduction to myself and to CRISP, although I'm sure y'all already know a little bit about CRISP. Then we'll go into the consent tool, kind of the value of the consent tool, and then how you actually use it before we just go on to any questions. Next slide. My name's Maya Gottlieb. I'm the behavioral health lead at CRISP, which means I work in a variety of areas on behavioral health, including data, in multiple ways, including protected data and data that folks can see, and trying to encourage the use of CRISP by behavioral health folks and increasing its value to behavioral health folks. Our outreach liaison, Biniam Asfaha, is also on the line if folks have any questions. Okay, next slide. So just a quick reminder about CRISP and kind of our goals here. CRISP is Health Information Exchange, or I might say HIE. So our goal is to help doctors, hospitals, and healthcare professionals deliver better care by promoting medical data sharing across the region. So this is data that we share, of course, between different types of sites, not just hospitals, but ambulatory sites, CBOs, et cetera, so that providers can really have the most comprehensive understanding of their patient possible. We also work with the state of Maryland for public health initiatives, including evaluation of certain projects, public health reports, things like that. And we also work on ways that we can lower costs. You know, if someone already knows that a test has been completed, they don't need to reorder it, for example. If we know that a certain kind of procedure leads to lower readmission rates, then that's, you know, good information to have, things like that. So CRISP really tries to cover kind of all of the data that's available around patient care for purposes of treatment, but also public health, and do whatever we can there. And this, of course, extends to behavioral health as well. Next slide. So the consent tool. So this is a tool that's in our portal, and it's also in our in-context tool if you access CRISP via an EHR. But the goal of this tool is it was originally designed as a platform for providers and staff to register patient consents to share 42 CFR Part 2 protected data. So this is data that is from a site that holds itself out as being 42 CFR Part 2, which is generally a site that is focused on substance use disorder, but it's up to that site to define themselves as a 42 CFR Part 2 site. CRISP doesn't define it. But if you say we're a 42 CFR Part 2 site, then all of your data would be protected under consent. We also have other scenarios in Maryland where patients may need to opt into sharing certain data per state law. So that's also in this tool. This presentation is going to focus on the 42 CFR protected data, but it's worth knowing that our consent tool applies to other use cases as well. And of course, our ultimate goal with this tool is really to protect patient privacy at the same time as we promote better patient care. So it's balancing those two needs. Next slide. So I'm going to show you the form in a bit, but a little bit about the form itself is that the goal of this form, you know, is to allow providers to share 42 CFR Part 2 substance use disorder information for the purposes of treatment, payment, and healthcare operations. You know, folks may be used to signing consents in other venues, but we have our own consent specifically for CRISP, and that's what this form is for. So as I said, this includes data from 42 CFR Part 2 providers that contribute to CRISP. It also includes data from other sources that have been classified as Part 2 data. So in general, we have a lot of data sources beyond just healthcare providers. One of the biggest sources that we have is claims data. We have a whole claims data section, and some of that could be considered Part 2 data. So we have a Part 2 code committee at CRISP Shared Services. So all of our affiliates come together and determine which codes are subject to this for this kind of data. And then those codes are also hidden behind consent. Okay, next slide. So I think that's important to mention because that is a really valuable source of data that's often hidden behind consent, that claims data I was mentioning. As I said, there's also Part 2 data from Part 2 sites, both in Maryland and elsewhere. DC, for example, that comes through that is hidden behind consent. And that could include notes and encounters, panel information, and care coordination information. And then there's also claims data, right, which is a valuable source of information, particularly for medication. That is hidden behind consent. So I just pulled these numbers quickly, but there's 180 million Medicaid claims that are under consent. We have case mix claims that are under consent. So this is data that is hidden from all providers unless there's a consent for that particular patient. And I know that there's particular interest in buprenorphine information since it's not always available in the PDMP, depending on the provider and how it's distributed. So there's also claims information specific to buprenorphine that's hidden behind consent because that's considered Part 2. And that's an important medication for the treatment of substance use disorder, just in case folks aren't aware. And so I think it is really valuable to use this tool to provision consent for substance use disorder data, to allow providers to exchange this information. It also, once folks know, oh, my information is visible, this information can be shared, it encourages Part 2 providers to share data. They know that it's protected, but it's shared with consent. And so we're trying to encourage that kind of virtuous cycle of sharing data and viewing data when appropriate and with consent. Next slide. Okay, so I'm going to go through how you actually access the tool, what it looks like, and the different components of it. So as I said, the HA admin tool is located in the CRISP portal. Next slide. But if you can access it through the EHR, and there should be an app section. I don't have the EHR, so I can't really show you, but there should be an app section where you can click on apps and see consent for that particular patient. If you experience an error with that, please email me. We've noticed that some organizations have yet to whitelist that particular tool. And so that could be an issue if you can't access that tool. So I really appreciate your help in making sure that everyone who can is able to access this tool. Okay, next slide. So the first thing that you'll see, you'll query a patient. The first thing that you'll see is this your patient, right? And you're probably used to this if you've queried CRISP before, but this also applies to consent. So you'll attest that you have a patient relationship and you'll choose a reason. Either it's a new patient or a treatment. And this is particularly for patients that aren't already on your panel. Next slide. So then once you have queried your patient, attested to the relationship, and clicked on the consent tool itself, you'll see this. This is the consent tool. And the first option here is what we're going to focus on today. That's disclosing substance use disorder and mental health treatment information. As I said, there are other use cases, and you're welcome to explore those. And I think we have more information about those online as well, or you can follow up with me. But we're focusing on the Part 2 form today, and that's that first one. Next slide. So first, it'll share the patient information. You can confirm that this is the patient information. And ideally, you're going through this with your patient and making sure that it is all correct and that they understand what the consent is for. Next slide. So this next bit is information about the consent, right? Where you're informing them that they're consenting to share their information with all providers for the relevant purposes, treatment, payment, and operation. It's all providers, right? It's not specific providers. Anyone can see this data who's in our shared network and has the appropriate permissions or attest to their permissions. I have included an FAQ, and that's also in the consent itself about the consent tool and what they agree to. So then they'll ask you to authorize that. There we go. Next. And then there are a couple of other sections I want to go through as well. It'll also authorize the purposes of the treatment operation, what's included in this data, which you see there. It could be clinical documents, lab results, discharge, medication information, and claims data. And then you have to click consent for these purposes. Next slide. And then there's a bit more information on the expiration date, and we'll go through that as well. You do have the ability to choose a specific expiration date for this consent or to leave it blank and have it not be expired. Either way, the patient can always change their mind. You can always go back and revoke a consent. That's an important part of this. Or you can have it automatically expire at a certain point. Okay, next slide. So this is a bit about the revocation, the ability to revoke this consent, which again, the patient can do at any time, and we automatically will include that. So the expiration date is set as a default to be blank, but folks can toggle their expiration date so that the consent would expire at that point. For telehealth patients, it has to be edited to match what's on the form. And for in-person visits, it can be updated to anything in the future. Next slide. And this goes through that explanation for patients. And you'll see there in that second section, the expiration date, the toggle, you can choose that, toggle it on so that there is an expiration date, and then you choose the date below through a calendar tool. Next slide. And then there are two sections here. So the person who's obtaining the consent, who's filling out this form, has to verify that they have verified the patient identity. It is who is in the form. And they've also walked through the consent with the patient and informed the patient all the terms of their consent. It's the patient education attestation. Next slide. And then there's a signature section. And there's a box, folks can just go ahead and sign it. And then I'll talk a little bit more about the registration of consents on file. But this is if you have worked with us and your organization has agreed that you have a consent already in your workflow that aligns with the CRISP consent, you can simply click this attestation, and we will know that you're attesting that your consent complies with the CRISP requirements, and you don't have to fill out a separate consent with that patient. Now, that's something that I'm happy to work with folks on if they're interested in that. And we also would need to have the ability, right, to go back and check that consent and make sure, yes, it does comply with our requirements. Next slide. So you'll see here just the patient signature, how they can go ahead and sign, and then the name of the person registering the consent. And then on the next slide, I believe it's if you are with a patient and they have a legally authorized representative who's signing in their place, there's going to be a couple other checkboxes. So there's going to be a little checkbox that says, I am the patient's legal guardian, parent, or representative, and I have the capacity to consent on their behalf. And then you would need their signature as well. And you would also have to enter their name into the form and sign it. If you go to the next slide, you can see that in action. So that first checkbox is check here if you are the patient guardian, and then you'll see that signature section only shows up if you have checked that box. And then you'll see the second checkbox is check here if you would like to require both a patient signature and a legal guardian signature, and then you'll see yet another signature pop up. Next slide. Yeah, like so. So this is what I had mentioned before about the attestation, and I'm happy to just kind of go over this again. CRISP, as I said, we offer the ability to submit a provider attestation of consent, given that the consent complies with CRISP requirements. So we need the consent to be explicit in saying that your data will be shared with CRISP, right, for the purposes of treatment and payment operations, et cetera, et cetera. We have a form that kind of tells all the requirements for consent to comply with CRISP. And then once we have that on file with you and we ensure that it complies, providers can attest that it complies. And then this is a way that they don't have to go through another consent with their patient, right? If you've already done a consent and it includes all the CRISP requirements, great, you can just check that off. We are also working on a way to do this through bulk, right? So you have attested that you comply with our consent requirements, and instead of going patient by patient in our tool like so, you can send us a bulk file with a list of all the patients, and we can upload it into our system and have it consented. So if that's something you're interested in working with us on, I'd be more than happy to connect. Um, we're hoping that that's kind of a more efficient way to really get consents in the system and ensure that that data is available when it should be. So then once you submit consent, you at the bottom there's a thing that says submit. You click it, you'll see we successfully submitted this consent, and you can click exit. And then I did want to see consent history. So if you see at the top there are two menu options. What we've been focusing on is the left, the consent section. The second section is consent history. So you can just click on over to that for the patient. And you can see yesterday I just went through and did this for a test patient here. I submitted a consent for them. It had no expiration date. But if I've changed my mind or the patient has changed their mind and I would like to deactivate it, you can go ahead and click deactivate on that far right. And if you go to the next slide, you'll see it'll pop up, say, are you sure? And if I click deactivate in the next slide, you'll see it now is grayed out. It's inactive. So that's a way that you can track your consents for a particular patient and ensure that that's no longer available. Okay, next slide. So that's really the overview I wanted to give today. I see we already have 2 questions. So first, is the consent tool specific to mental health and SUD? So no, in Maryland, it is not. It has a couple of different use cases. This is the particular form. If you go back to the first slide, I think, or the second slide, third, one of the earlier slides, you'll see some of the other options. For example, there are particular codes around abortion that you can obtain consent for, or particular codes around specific protected health data. I was just focusing this presentation on substance use in particular, since I know it's an area that folks are interested in. Sorry, Laura, to make you run through the presentation. And the recording will be shared, and so you don't have to worry about that. But also, I would recommend, we can certainly do a consent overview, perhaps with our consent expert, that goes over the other types of consents in our consent tool. I'm focused more on part 2. Are there any other questions about consent or part 2 data in CRISP? I would love to hear if anyone has any experience with this or concerns. We're always trying to improve the process as well, make it as easy as possible. So I really appreciate you joining and your feedback for sure. And if not, I'm happy to end this early. You can always reach out to our support email there, or you can reach out to me directly. It's my first name, my last name at crisphealth.org. I really appreciate your interest in this area, and I'm really hoping that we can kind of do more to help people understand the consent tool, the value of consent tool, and how to use it. I think that's it. We'll go ahead and send the slides out as well and make sure you have them and the recording. Thank you.